contaminated with bacteria, viruses, and parasites. It usually happens when there is a big event and the food is incorrectly prepared and cooked. What are the symptoms of food poisoning? Abdominal pain and cramps, vomiting, diarrhea, fever, and nausea. When this happens, here are some first aid tips and advices. Rehydrate. Drink clear liquid starting with small sips and gradually drink more. If diarrhea and vomiting last more than 24 hours, drink an oral rehydration solution. You can make a homemade oral rehydrating solution with a combination of 1 liter of water, 8 teaspoons of sugar, and 1 teaspoon of salt. When abdominal pain occurs, give them hot compress. Let the patient rest. When the patient's condition got worse, call for help from medical emergency services or take them to the nearest hospital.
It's a serious life-threatening condition that happens when a vital organ in the body are not getting enough blood flow. Shock can be caused by anything that reduces the circulation of blood flow. When this happens, here are some first aid tips and advices. Step is lay them down. The second step, check the pulse. The third step, raise their legs using chair. The fourth, call emergency hotline. And the last step, keep them warm and calm using covering blanket.
A burn is a type of injury to the skin caused by heat, cold, electricity, or chemicals, but most burns are due to heat from hot liquids, solids, or fire. When this happens, here are some first aid tips and advices. First thing to do is to cool down the heat by placing the damaged skin under the water for at least 10 minutes or until the pain gets better. This will decrease the severity of the injury or to avoid spreading the heat. Remember, don't use ice, gels, or creams as this could damage the tissue and increase the risk of infection. Gently remove jewelry or other clothing near the burn. Use a gauze. This will protect the burn from infection. This basic first aid is advisable for minor burns, first to second degree. If you are suffering for a severe burn, it is better to consult a doctor for the best prescription.
A wound occurs when the skin is broken. A minor wound typically does not need medical treatment. It is one that is small and sufficiently clean so that the edges can be easily approximated by using tapes. So, when this happens, here are some first aid tips and advices for you guys.
First, we should put a pressure in the wound about 10 minutes. After that, wash it with soap and clean water. After that, prepare the things we needed for treating the wound. Apply an ointment in the wound. And lastly, put a bandage in the wound. Leaving a wound uncovered may dry out new surface cells, which can increase pain or slow off the healing process.
Is a stretching or tearing of ligaments. the tough bands of fibrous tissues that connect two bones together in your joints. The most common location for a sprain is in your ankle.
Avoid activities that cause pain, swelling, or discomfort, but don't avoid all physical activities. Even if you're seeking medical help, ice the area immediately. Use an ice pack for 15 to 20 minutes each time and repeat every 2 to 3 hours while you're awake for the first few days after the injury. To help stop swelling, compress the area with an elastic bandage until the swelling stops. Don't wrap it too tightly or you may hinder circulation. Loose the wrap if the pain increases. The area becomes numb or swelling is occurring below the wrap area. Elevation. Keep the injured area raised above chest level if possible.